time for my newborn assessment. I am going to wash my hands before I come in the room. And I'm going to take a look at the baby. We're going to take a look at the wristband. Make sure we're assessing the right baby. Okay. Baby Jordan. Alright. And we are going to go ahead and we are going to uncover you. And we are going to take your vitals. We're going to take this temperature probe and I'm going to stick it under your armpit, under your axillary, and along the length of your arm, and hold your arm down. Okay. And while we're doing that, we're waiting for your temperature, I'm going to put my hand on your chest, just try to comfort you, and I'm going to just check your respirations while we're doing this too. We're going to do that for about a minute. Okay, and your normal temp should be about 97.7 to 99.0, and your respiration should be about 30 to 60. All right, and we are going to check your pulse too. I'm going to listen for that. Stethoscope on. Okay, so we're going to take a listen to the apical pulse for a whole minute because baby's heartbeats can be irregular. We're also going to listen for a murmur while we're doing this. Should be maybe a little swoosh sound. We're just going to listen for a full minute. Okay, that heart rate should be between 100 and 160. All right, and we are also going to listen to, well, we got you here. Listen to your breath sounds. Above the midline, little breaths. Might be a little crackly just because there might be some amniotic fluid in there. Again, above the midline and then below the midline with the nipple. Okay. Listen to your belly too. One quadrant. Okay, over. Okay, I'm hearing active sounds in all 4 quadrants. Okay. Go ahead and take this off. Alright, we're going to get you covered up a little bit. Alright, we are going to take a look at your head here. Take your hat off. Okay, and we are just going to take a look. We are checking for any bruising or edema or hard spots on your head. We're also going to get your fontanelles. So your fontanelle, your anterior fontanelle will be this top one on the top of your head. Should be soft and flat. It's a diamond shape. And then we're going to check the posterior, which should be a little bit smaller, about a triangular shape. Okay. And that edema we're looking for is called the caput succedaneum, and that is going to cross the suture line. So if we have that, it's going to be on both sides. Or hematoma is just going to be on one side, and it's going to be a little bit harder. And we are also going to look at any scratches or bruising again. If there was like an internal fetal monitor that was hooked to your head, or if the doctor had to break the water, it may have scratched the baby's head. Also, we are going to look at making sure there's no molding, which could be possible if it was vaginal birth and the suture lines aren't really visible because the bones in the baby's head have gone over each other and overlapped. Okay, and we are going to move down now. We're going to look at your eyes and we're going to make sure that they're symmetrical. And we're going to do the third rule and eat from the inner canthus to the outer canthus of each eye. They should be the same, and that should be about the same as what the bridge of your nose is. So that looks good. We're also going to look for any discharge coming from the eye, and we are going to look for some subconjunctival hemorrhage would be the bloodshot eyes. And we are also going to look at the inner canthus of your eyes to see any epicanthial folds, which if that is there, that could be indicative of Down syndrome. Okay, and we are going to move to the ears. And again, we're going to measure from the outer canthus of the eye or inner canthus to outer canthus to the top of the ear, and that should be about a straight line. So it looks good. And then we are going to make sure that they are positioned, or that was the position. We're going to look at the cartilage. We're going to bend the top down, let it go up. That cartilage should bounce back pretty quickly. We're also going to take the outer ear, we're going to fold it in and let it go, and that should bounce back pretty quickly as well. Alright, let's move on to your nose. We're just going to cover one nostril and check and see if we can feel air. Okay, and then we're going to check the patency of the other nostril and feel for air. Alright, and we are going to throw some gloves on here. I'm going to cover your head up too. Alright, and we are going to have gloves, and we're going to just rub our finger by the corner of your mouth, and hopefully you start to root and you open your mouth, and I can feel on the top part of your mouth, your hard palate, and see if there are any openings or holes. It should be intact. And we're also going to assess how you're sucking my finger at this time to make sure you have a good suck. Alright, and we are going to look at your neck now. So we're just going to take our fingers towards the back of your neck. We're just going to go all the way around, do a little pushing and feeling and see if we find any lumps or masses. Okay, we're also going to take the baby's head and turn it to one side and the other, checking the range of motion. Alright, and then we are going to move down to the baby's clavicles and check those and feel those and make sure those are intact, because it's possible that you could have had a fracture during delivery if it was vaginal, because sometimes that can break a clavicle. And those are good. Alright, we are going to go ahead and undress the baby Jordan. Take this off of you, get you uncovered. Alright, we're going to look at the skin. We're going to check for any birthmarks, bruising, the color of their skin, if you've got any vernix or the white cheesy substance. We're going to check for lanugo, which is the fine downy hair, and that would probably be on your back if we had any, and that would maybe a sign of prematurity. We're going to check for your skin turgor, how fast or how hydrated you are. We can either check that by pinching the belly right here, or we can check it on the thigh, and that should be pretty brisk. It should go back pretty fast. Okay, and we are going to check for jaundice as well. So let's see the top of the forehead. We're going to push down and blanch and make sure we don't see any yellow. So there's the forehead. We're going to do the chest, the abdomen, the inner thigh. Okay, and back up to the eyes and see if that color is white or if it's a little yellowed, which could indicate jaundice, which is an excess of bilirubin. While we're here, we're going to check for if there were signs of respiratory distress. We want to know that. So we're going to check for nasal flaring, which would be the flaring of the nostrils when their baby's breathing. If they're making a grunting noise when they're exhaling, it could be a sign of respiratory distress. If there are indentations between the ribs or up by the clavicles, this could be a sign of respiratory distress as well. Seesaw breathing would be with the chest and the belly rising back and forth. And then we also have, we'll watch and make sure that there's no apnea or no more than 20 seconds that a baby goes without taking a breath. Okay. We are going to look at your belly. We're gonna make sure it's slightly round. We can push on and make sure it's soft and not hard, because we don't want any bleeding or any masses in there. Alright, let's check out your little cord, your umbilical cord. Gonna take a look and we're gonna measure how dry it is, if it's moist, drying, or dry, if there's any smell or discharge. There shouldn't be any weird smells coming from that. Okay, we are going to go ahead and check your diaper too while we're down here. Alright, and I'm going to put those gloves back on, make sure I have them on. If I didn't already do that, you're a female, so we're going to look at your labia, make sure your labia are intact, and that if you're full term, they're going to be covering them up labia minora. All right, and we are going to check for any discharge, and at this point it could be a white mucousy discharge or have little red flecks in it. Because of the hormones from the mom, it can cause a pseudomenses from the baby. And we are also going to see if you peed or pooped at this time. And we're going to change the diaper if we need to and chart that. If you were a boy, we would want to take a look and make sure your testes have descended. So again, depending on your maturity, but if you're a full-term baby, we're going to go ahead and put our index finger on your inguinal canal and stop that, and we are going to feel your testes between our index finger and our thumb and see if we can feel one in there on both, and then try again on both sides. Okay. And we're going to take the penis and we're going to lift it up, and we're going to see if we can see the meatus. And we're also going to determine whether you're circumcised or not. If there's still foreskin there because you're uncircumcised, we're going to pull it back slightly, just ever so slightly, just to see if we can find the meatus and make sure it's right on the end and it's not on top or bottom. And then if you're circumcised, we're going to see how the bleeding is and make sure everything looks okay. It could be a slight red and raw look and have a little bit of yellow exudate, but that's normal. Okay. And also on the testes, we're going to check for the rugae, the little folds, to make sure that is there. Get you covered. Put your diaper back on. Okay. And we are going to check for your resistance and recoil. And I'm going to demonstrate this because the baby's arms can't really move. And I would check and bend the baby's arms up and down. And as they're straight, I'm going to let go and see if the baby recoils and pulls their arms back up. Again, I'm going to do a similar thing on the leg and bend the knee up and then bend it straight and see if the baby pulls the knee back and bends the leg. And that would be normal if they do that. I am going to look at the hands and the fingers and make sure that we have all 10 fingers. We're going to look at the palmar creases, and there should be multiple of them. If there's just one, that could be an indication of Down syndrome. These ones look good, and we're going to move down to the toes, and we're going to look at those 10 toes. The creases in the bottom of the feet should be the top 2/3 anteriorly of the feet should have creases on them. If it's only the top third, that again could be an indication of Down syndrome. And we are going to look at your spine. So we are going to flip baby over, and we are going to support the head. And we are going to look at your spine and run our fingers up and down and make sure it's smooth. Pull your diaper down and look at right above your bottom, and we're going to look and see if there's a dimple or if there's a tuft of hair. If there's a dimple, that could mean that your spinal cord didn't close all the way, and we don't want that. And the tuft of hair is not a good sign as well. And we're going to pull down your diaper, look at your bottom, and there should be, we're going to look at the hips. The hips should be, we're looking for symmetrical hips, and we're going to look for that gluteal smile underneath the bottom, underneath the butt, and that should be equal on both sides. We don't want any abnormal creases in there. And we are going to flip baby back over. And we are going to cover you up a little bit. Put that back on, make sure your diaper's on. Okay. Make sure you're nice and warm. Okay. And we are going to check for your Moro reflex. So we're going to clap, or we are going to hit the table, and the baby should adduct their arms and then abduct their arms, and possibly make a little C shape with their fingers when they throw their hands up. That's totally normal. We're going to make sure that we're documenting the infant's behavior the whole time, if they were more awake or crying or sleeping. We're gonna assess the baby's stools and voids. And if we don't know when the last one was, there's usually a clipboard at the edge of the bed or the cart, depending on which hospital it's at. You can look at that, or the chart in the computer, or if the mother or father are in the room, you can ask them. We can also need to look at that chart as well to see when the last time that they were fed. So that needs to be every 2 to 3 hours, or a maximum of 4 hours, which means that with a newborn, it'd be good to wake the baby up and let them eat and go back to sleep. Okay. And at this point, sometimes they weigh the baby, and that would mean that you strip them down naked, put them on the scale, and you weigh them, and then record that in your notes. All right, and any abnormal findings I would report back to the nursery nurse, the mom and baby nurse, and my instructor. Okay, all done.